In this module, we'll consider a policy area which has attracted significant attention from the American public and policymakers alike, that is, U.S. health policy. To really understand this policy area, we have to understand what type of system we have, as well as the history and evolution of government involvement in healthcare into the present day. The United States employs a pluralistic or hybrid system, which is basically just a hodgepodge of public and private funding. The government provides a variety of options for certain classes of individuals, but the bulk of healthcare in the country is provided by private insurance from our employers, which is ultimately funded by the individual consumer. Our pluralistic system is different from ones you may have heard in the news media, other countries around the world, or even attempted in certain states like Vermont. These are publicly funded plans, like the single-payer system, where essentially the government pays, or a national system, which is essentially a single plan that is still private. The idea of healthcare has changed significantly since the start of our country. From the start of the country up until about the 1930s, healthcare was provided by essentially the individual, or the community. Religion played a significant role in helping to provide for the poor and for those in the community that were sick. Additionally, immigrant communities helped to provide for healthcare of their own. It wasn't until about the 1930s, and dealing with the Great Depression, that the government started to increase its role. Up until this point, it was really concerned with more of public health and protection than healthcare per se. Government was given power to regulate things like sanitation, disease control, and even things like food safety. If you've ever read Upton Sinclair's book, The Jungle, you know exactly what we're talking about here. In particular, the canned meat industry. The role of government in the providing of healthcare was not even part of the Social Security Act in 1935. Yet, moving forward in history, the government's role in the provision of healthcare slowly increased. Yet, at the end of World War II, the federal government was wary of post-war inflation. The administration saw the terrible devastation that hyperinflation wreaked on post-World War I Germany, and they were determined to hold it at bay through wage and price controls. Yet, in reaction to these wage controls at the end of the war, many labor groups planned to go on strike en masse. In order to avert the strike, in a concession to the labor groups, the War Labor Board exempted employer-paid health benefits from wage controls and income tax. Through the 1950s, this accident created a tax advantage that drove enormous amounts of demand for employer-provided health insurance plans over previously more common individual health insurance. Employers received a 100% tax deduction, while the benefits employees received were exempt from federal, state, and city taxation. Yet, while there's demand for these employer-based health deductions and health insurance, well, certain individuals, this was problematic for them, in particular, the elderly and the poor. This led to the government stepping up in amendments to the Social Security Act, in particular, the creation of programs like Medicare and Medicaid. The system of employer-based health insurance tied to work, with the government filling some gaps for certain classes of individuals, has persisted to the present day. The system has become more complex as more actors have gotten involved in the provision of healthcare, and ultimately, the business of the provision of healthcare. We've seen an increase in profit-seeking companies that are involved in providing this. Yet, despite the coverage that we receive from employers as well as the government, we still have significant concerns about the uninsured and the growing costs of healthcare. These concerns led to the most recent comprehensive overhaul to the healthcare system in 2009 of the Affordable Care Act, or Obamacare, as many people call it.